This is a tutorial on how to populate the instruction template for future medical costs relating to claimants with cerebral palsy. The first tab of this template is a general information tab that contains a summary of the basic information we need to create an actuarial report. In the first section, you would capture your name as the instructing attorney, the name of the firm you work for, and the reference number you will be using for the specific matter in question. In the second section, you would capture the details of the claimant, that is, their full name, gender, date of birth, the date that the incident occurred, and, if applicable, a specific instruction for how the claimant's life expectancy is to be adjusted. And finally, in the third section, you would list the expert information that contains the future medical costs to be quantified. Here is an example of what this tab should look like once it has been populated. Note specifically how the information has been captured in the third section. In the first column is listed the names of the experts. In the second column, there are various areas of expertise. And in the third column, the date that their respective reports were drafted. The second tab of this template is the Costs tab. This is where you would input the costs as given by each of the experts. This template contains the common wording used by experts to describe the costs that they recommend for claimants with cerebral palsy. We created a list of this wording by perusing the future medical costs calculations that we have previously quantified for claimants with cerebral palsy, and gathering the descriptions that we had used for similar costs given by the experts across our calculations. The report or source column is where you would select the name of the expert giving the specific costs. The item number column indexes the cost number as you populate the table. The description column is where you would input the cost item as described by the expert. The amount column is where the RAND value associated with the cost described in the previous column would be captured. The quantity column is where the indicated number of units of the suggested cost would be specified. The frequency column is where the frequency with which the cost would be incurred is specified. The standard frequencies provided are per week, per month, per year, once off, and spread for life. You can also type in any other specific frequency that is not provided on this list. The age start column is where you would specify the age from which the suggested cost will be incurred. The default start age is the current age of the claimant. The age stop column is where you would specify the age where the claimant will no longer require the cost item. The default stop age is unspecified and therefore we put wording to say for life. And finally, the chance column is where you would specify the probability of the cost item being required by the claimant. For instance, let's say that the occupational therapist, Richard Jones, suggests that the claimant receives 25 sessions of occupational therapy per year at 750 Rand per session. This information will be inputted as follows. In the report or sources column, there's a drop-down menu that has a list of the names of the experts that was inputted in the general information tab. So in this case, Richard Jones, the occupational therapist, suggested occupational therapy sessions, which we would search in the search bar as follows. And you would see that there are various descriptions, cost descriptions associated with costs that could be given by an occupational therapist. In this case, we're going to select occupational therapy sessions and press add to add it to our table. It said that each session is about 750 Rand, and Richard Jones suggested that we have 25 sessions per year. And given that there is no end date suggested, we would allow for the cost for life. Similarly, say for instance that the physiotherapist, Natasha Webb, suggested physiotherapy that should be done monthly until the age of 18. So to input the cost of physiotherapy sessions, I would search for physiotherapy in our search tab, click the applicable option and press add. And for instance, let us say that each session would be 450 Rand. And we're saying one session per month, starting from now until the age of 18. Additionally, let us say the general practitioner, Dr. Nicholas Harry, suggests that the claimant be prescribed pain medication for the rest of their lives, that they will need to restock every 3 months. As I just shown you, I would search for pain medication in our search bar, click add, and it would be added to our list. I'll then input 850 as the first amount, that it would be needed once every 3 months, which is what I would type in, given that that is not one of the 5 standard options for frequency, and that this cost will be needed from now and for the rest of their lives. And the final example would be a cost given by the orthopedic surgeon, Dr. Penny Holden. Let's say, for instance, she suggests a hip replacement at age 25. Note that there is no wording for hip replacement in our list of common costs that are suggested by the experts in these matters. So I would type out the entire description and click add, which adds the wording for hip replacement to our list of common costs. And then when I type in hip again, you would see that the option for hip replacement has been added to our drop-down list. So now click that, click add, and let us say, for instance, that this would be at a cost of 150,000 Rand, which would be incurred once off at age 25. And we will carry on populating this table as I had shown you for the 4 previous examples, until we have populated all the costs suggested by each of the experts. Thank you for watching this video. I trust that you found this explanation helpful.